Welcome to Steel and Velvet Counseling. I'm Dr. Dave Jones, and today's podcast is entitled Everything You Think You Know About Addiction is Wrong. In a previous podcast, I did a series on depression and anxiety and the current scientific and medical and educational studies done worldwide with respect to those two issues, written by the same person, Johann Hari. The name of the book is called Lost Connections. But today we're going to be discussing addiction. So, what causes addiction? What is addiction? I knew a long time ago what addiction is. We all do. As a culture, we have a story about how addiction works, and it's a good one. It says that some substances are so chemically powerful that if you use them enough, they will hijack your brain. They will change your neurochemistry. They will give you a brain disease. After that, you will need the drug physically. So if you or I or the next 10 people you pass on the street were to use an addictive drug every day for the next month, on day 30, we'd all be addicts. Addiction then is the result of repeated exposure to certain very powerful chemicals. When I looked at the people I love who have become addicts, that is what I believed had happened to them. I also thought that chemicals hooked you forever so that you should be shut away. I thought the chemicals hooked you forever so you should be given to them by doctors forever. And the process continued in that the moment the authorities found out you were an addict, they would throw you out of public housing and cut you off from all social support. Get clean, they would say, or you will never have a home again. Often, even the homeless shelters would turn them away. And oftentimes we would ask ourselves, why are they doing this to themselves? Why would somebody be so foolish? Why do we have somewhat of a moralistic attitude towards them? The addicts had been made to feel disgusting and ashamed all their lives, and only the drug took this sense away. One lady told me, she says, the first time I did heroin, it felt like a warm, soft hug. So what did they all have in common? Horribly disturbed childhoods marked by violence, sexual assault, or both. Could it be that these hardcore addicts were all terribly damaged before they found their drugs? What if the discovery of drugs wasn't the earthquake in their life, but only one of the aftershocks? All over the Western world, people are being given very powerful opiates every day, legally. If you had been badly injured in a car crash or had a hip replacement or had significant dental surgery, you probably were given opiates, perhaps for quite a long time. So if the pharmaceutical theory of addiction is right, if the drugs are so chemically powerful they hijack your brain, then it's obvious what should happen. You should, at the end of your treatment, be an addict. When you are discharged from the hospital, you should be looking to score on the streets because now you need your fix. Yet you will have noticed something. You didn't become an addict. You see, there was no significant risk of addiction, a finding common to all studies that examine the relationship between addiction and the use of narcotics for pain relief. You can take the same drugs as an addict for long periods of time and not become addicted at all, and at the same time, you can take no drugs whatsoever and become just as severe an addict. So, nothing is addictive in itself. It's always a combination of a potentially addictive substance or behavior and a susceptible individual. So the question we need to keep asking is, what creates the susceptibility? Since the drug alone can't explain the addiction, there is clearly an additional ingredient or several things that are present in some people but not in others. Scientists have discovered that for each traumatic event that happened to a child, they were 2 to 4 times more likely to grow up to be an addicted adult. Nearly 2/3 of injection drug use, they found, is the product of childhood trauma. It means that child abuse is as likely to cause drug addiction as obesity is to cause heart disease. It turned out the kids whose parents had been either indifferent or cruel were dramatically more likely to heavily use drugs than the others. They had grown up, they found, less able to form loving relationships, and so they felt more angry and distressed and impulsive a lot of the time. Their relative maladjustment, the study found, precedes the initiation of drug use. Problem drug use is a symptom, not a cause, of personal and social maladjustment. The basic cause of addiction is predominantly experience dependent during childhood and not substance dependent. Therefore, addicts often grow up in homes that are not homes, with parents that are not parents, so they seek escape. Girl or boy, this is a familiar pattern. The survivors of childhood trauma are often left with that sense of self-hatred all their lives. And now that is why so many of them turn to the strongest anesthetic they can find. It's not a spasm of irrationality. It meets a need. It takes away the pain for a while. And so get this. The reason for some people becoming an addict was because they have a tremendously poor threshold of pain. We sometimes think that people use drugs because they're bad or evil. Sometimes the softest people use drugs because they can't take the pain. The childhood trauma makes you feel bad about everything, bad about your family, bad about life. Then when you take drugs, they make you feel good about your life, about yourself, about being in the world. People wonder, why do addicts keep doing it? The answer is because it makes them feel good, and the rest of their life doesn't make them feel good. Let me give you an example. This is one about a doctor and a patient relationship during World War II. The doctor's name was Dr. Gabor, and he learned that there was a connection between traumatic early childhoods and compulsive behaviors. And then he began to think about what the doctor told his mother all those years. All my Jewish babies are crying, the doctor said. The babies obviously couldn't know that a genocide was taking place, but they did know on some level that their mothers were distraught and not able to meet their needs. The patient's own mother, he says, was stressed and depressed. She said the only reason she got out of bed was to look after me. So I saved her life. It's a hell of a responsibility for a 4-month-old to save his mother's life. She carried tremendous pain, tremendous grief, and as an infant, you absorb all that. So he developed differently from a baby whose mother was able to offer calm and consistent love. Now, as an adult, he found himself unable to control himself at moments of stress. For him, the outlet was to buy music. He realized that when he was a small child, there was one thing that relaxed his mother, and so in turn, relaxed him. She would listen to music. Now it was the thing he tried to buy and hoard as if it held the secret key to being calm. He said, I wasn't traumatized by my parents' psychological dysfunctions. The trauma I sustained was the trauma they sustained. It came from the outside. What absolutely surprised me was that all this information hadn't been brought together before. Nobody had brought together childhood trauma, brain development, and the stories of the addicts that we work with to provide a coherent theory of addiction. It plainly cannot be the case that all addicts were treated appallingly as kids. It's an important factor in addiction, but it is not enough. Some people do not have traumatic childhoods, yet they still become addicts. What is going on with them? The core of addiction doesn't lie in what you swallow or inject. It's in the pain you feel in your head. Yet we have built a system that thinks we will stop addicts by increasing their pain. The more you stress people, the more they're going to use. The more you de-stress people, the less they're going to use. So to create a system where you ostracize and marginalize and criminalize people and force them to live in poverty with disease, you are basically guaranteeing they will stay at it. Since child neglect and abuse is a major cause of addiction, if we were serious about reducing the number of addicts, we would start at the first prenatal visit, because already the stresses on the pregnant woman will have an impact on the potentially addictive propensity of the child. We would identify the mothers who are most stressed and least able to cope, and we would give them extensive care and support and coaching on how to properly bond with their child. Then after birth, we would keep carefully identifying mothers who are having problems bonding with their babies and offer them wraparound care. We would be highly vigilant for the parents who still can't provide for a safe home or who would become abusive, and find an alternative loving home for the child if we had to. These are approaches that would over time reduce addiction instead of deepening it. Here, the heroin dependency. Let me give you some evidence that carries this thought a little further. Oddly enough, there was a large-scale human experience that people didn't realize that justified this statement, and it was called the Vietnam War. Out in Southeast Asia, using heroin was as common as chewing gum among U.S. soldiers, as Time magazine reported at the time. This wasn't just journalistic hyperbole. Some 20% of U.S. soldiers had become addicted to heroin there, according to a study published in the Archives of General Psychiatry later. This meant that there were more heroin addicts serving in the U.S. Army than there were back home in the United States. The American military had cracked down hard on marijuana smoking among its troops, sending in pot-sniffing dogs and staging mass arrests, and so huge numbers of men, unable to face that level of pressure without a relaxant, had transferred to smack, which sniffer dogs can't shuffle out. The soldier going to South Vietnam today runs as a far greater risk of becoming a heroin addict. Many people in the United States were understandably terrified. The war was going to end sooner or later, and at that point, the streets of America were going to swell with an unprecedented number of junkies. They believed the pharmaceutical theory of addiction, so this was the only outcome that made any sense. Their brains and bodies were being hijacked by the drugs, so as Senator Harold Hughes of Iowa warned, within a matter of months in our large cities, the Capone era of the 20s may look like a Sunday school picnic by comparison. The war ended, the addicts came home, and something nobody expected took place. The study in the Archives of General Psychiatry and the experiences people could see all across the country showed that 95% of them within a year simply stopped. The addicts who received drug treatment and rehab were no more likely to stop than those who received no treatment at all. A tiny number of vets did carry on shooting up. They turned out either to have been unstable childhoods or to have been addicts before they went. So, if your environment is a safe, happy community with lots of healthy bonds and pleasurable things to do, you will not especially be vulnerable to addiction. If your environment is a place where you feel alone, powerless, and purposeless, you will be. In order to punish addicts, the drug warriors have in fact built the very conditions that will be most likely to produce a deepened addiction. The soldiers in Vietnam weren't being hijacked by the chemicals at hand. They were trying to cope with being dislocated from everything that gave their lives meaning and pleasure. The world around them had become an unbearable place to be, so when they couldn't get out of it physically, they decided to get out of it mentally. Later, when they could get back to a meaningful life, they felt no more need for the drugs, and they left them behind with surprising ease. So you see, humans seem to have evolved with a deep need to bond, because it was absolutely essential to staying alive. And so when you look over the history of when addiction had suddenly soared among human beings, it was found that time and again, when these bonds were taken away from people, is when people became more susceptible to addiction. Today's flood of addiction is occurring because of hyper-individualistic, frantic, crisis-ridden society makes most people feel socially or culturally isolated. Chronic isolation causes people to look for relief. They find temporary relief in addiction because it allows them to escape their feelings, to deaden their senses, and to experience an addictive lifestyle as a substitute for a full life. A kid who is neglected or beaten or raped finds it hard to trust people and to form healthy bonds with them, so they often become isolated, and with the same effects. We should stop using the word addiction altogether and shift to a new word, bonding. Human beings need to bond. It is one of our most primal urges. So if we can't bond with other people, we will find a behavior to bond with, whether it's watching pornography or smoking crack or gambling. If the only bond you can find that gives you relief or meaning is with splayed women on a computer screen or bags of crystal or a roulette wheel, you will return to that bond obsessively. One recovering heroin and crack addict said it to me very simply. Addiction, he said, is a disease of loneliness. This is the end of part 1 of the podcast entitled Everything You Think You Know About Addiction is Wrong. I would encourage you to listen to the very motivating conclusion in part 2.